Grüezi ragazzi, willkommen and benvenuti to Cannabis Scienzias like LinkedIn Live for this week. To those of you joining us live, thank you for being here with us today. And for those who will be checking out the recording at a later time, also a big thank to you. We hope you enjoy it and that you perhaps leave this session having learned something new. So, for those of you who are following the Cannabis Sciences channel on LinkedIn, you probably know that in the previous events, which have been held here since 1 year, more than 1 year now, we usually invite a guest who is an expert in the field of medical cannabis to discuss a topic of interest. Now we are changing a little bit our life, making it more similar to a lesson in which we extract comments or paragraphs from our handbook principles of clinical cannabinoid. This is the handbook which I co-authored together with Viola Brugnatelli, the co-founder of Cannabis Scienza. Just to let you know, we have also the Italian version of the handbook, Principi di Cannabinoid Clinica, and we are planning also to translate the book in other languages such as Spanish or Portuguese. So if someone of you is interested in having a translated copy of the handbook, you can contact us here on LinkedIn or via our website cannabiscienza.com. So today Viola was supposed to be here with us, but she had a setback, so maybe she will join us later. And so I will be alone today, or rather I will be with you, the wonderful audience of Cannabis Scienza. So if you want, you can post comments or questions, and at the end of the live, if there is time, I will try to answer them. But without further ado, let's start with the topic of this live that is centered on the pharmacology of CBD. For those of you who joined us last week, we discussed about THC. So today we had another little piece of knowledge about phytocannabinoids. So let's start. Cannabidiol has been the first cannabinoid isolated in the cannabis plant in 1942 by the doctor and researcher Roger Adams. Very often, when I attend the conferences or talks like this about phytocannabinoids, it is said that the first cannabinoid to be characterized is the THC. This is also true. Let me explain. In 1942, the prohibition was still in place in the United States, and it was very restrictive. So Dr. Adam once isolated the CBD, who could not go on with this research because cannabis was considered illegal, and so CBD was not characterized. Indeed, in 1964, when Meshulam and his colleagues isolated THC, the situation in Israel was different. They were more open-minded than in the States, and so Meshulam was able to conduct his research that culminated with the chemical and biological characterization of THC. And it was only after the scientific success of THC, we can say in this manner, that the attention of the scientific community began to be directed toward CBD. Another belief about CBD is that it is a non-psychoactive compound. This is not correct because non-psychoactive means that a compound has no activity on the brain. But this is not true because we know, and we will see, we are going to discuss it later, that CBD has neuroprotective properties. It has anti-seizures activity and also anxiolytic effects. So it means that it possesses an activity towards the brain and the central nervous system. So it is a psychoactive compound. So maybe it will be more accurate to say that CBD is not narcotic. Indeed, the word narcotic derives from the ancient Greek word narco, which means I make numb, and it is referred medically to any compound with numbing or paralyzing properties, which can induce stupor, insensibility, can affect the conscious state, and so on. So CBD is a psychoactive compound. As we remembered in the last LinkedIn Live on THC, phytocannabinoids are produced in the cannabis plant in their acidic form. CBD is produced in the plant as cannabidiolic acid, CBDA, and subsequently, after the action of heating or drying, it is converted in the neutral form, that is CBD. The differences between these two molecules are due to a molecule of carbon dioxide that is removed from CBDA to form CBD. This process is called decarboxylation, and thanks to this modification, CBD is able to pass the blood-brain barrier and exert its effects on the brain. So this is the reason why I previously affirmed that CBD is a psychoactive substance, differently from CBDA, that is less lipophilic than CBD and cannot pass the blood-brain barrier. Let's explore now the pharmacology, the pharmacodynamic of cannabidiol. The pharmacodynamic of CBD is very complex. In fact, CBD can interact with several receptors in the body. For example, it can interact with the classic cannabinoid receptor CB1 and CB2, even if CBD has a low affinity for this receptor, but can modulate their activity indirectly. Indeed, someone thinks that it is a partial agonist or an inverse agonist, but it is able to inhibit, for example, the action of the fatty acid amide hydrolase, that is the enzyme which metabolizes anandamide. In this way, the concentration of anandamide is maintained for a longer time, and so it can act on CB1 and CB2, and this explains the action of CBD on classic cannabinoid receptor. CBD can act also as a partial agonist of serotonin receptors, such as the 5-HT1A receptor, which is involved in the regulation of mood, appetite, and pain perception. CBD can bind and activate TRPV1 or 2 receptor, which are involved in the regulation of pain perception and inflammation. CBD can interact with several GPR receptors, such as the GPR55, and also with the adenosine receptor, with the dopamine receptor, and so on. And it can also interact with the PPRs, which are intracellular receptor involved in the control of metabolism and energy balance. These are some of the molecular targets of CBD. And for a complete overview of all the physiological targets of CBD, you can consult our handbook principle of clinical cannabinology. Anyway, thanks to this action on multiple targets, CBD can exert a lot of effects, but both in the body and in the mind. Here we can see some of these effects. Here are other effects. Indeed, more specifically, for example, CBD can relieve anxiety. Indeed, it can interact with the receptor in the brain responsible for mood and anxiety, like, as I said before, the serotonin receptor. This way, it promotes the production of serotonin, which is known to have a calming effect on the brain. In this way, CBD can help reduce symptoms of social anxiety disorder, of post-traumatic stress disorder, and also of general anxiety disorder. CBD can be used to treat chronic pain conditions such as arthritis, multiple sclerosis, and other conditions because it has analgesic property. It also has neuroprotective properties, which means that it can help to protect the brain and the nervous system from damage. And for this reason, can be useful to treat neurodegenerative diseases such as Parkinson or multiple sclerosis. CBD has been found to reduce the risk of artery blockage, which can lead to heart attacks and strokes. It can help to dilate blood vessel and improve blood flow, which can reduce the risk of cardiovascular complication. CBD has anti-inflammatory property, and these are one of the most characterized property, and we see more in deep in the following slides. And CBD can also, for example, promote bone growth and healing. And for this reason, it has been proposed as a treatment for conditions such as osteoporosis and bone fractures. Indeed, it can interact with cells responsible for bone formation, such as osteoblasts and osteoclasts. And in this way, it can help stimulate new bone growth. These are the main effect. These are other effects attributed to CBD, other than the anticonvulsive effect. It has antipsychotic, immunomodulatory, antioxidant effect. It is antiemetic. It is a muscle relaxant. It can slow intestinal motility. It can reduce high pressure. It is also anti-carcinogenic, and it is derived from in vitro study, but we will see it better in the following slides. Now let's see the action of CBD in some specific condition, for example, in inflammation and pain. Indeed, CBD has anti-inflammatory properties and analgesic properties, and so it can influence the perception of pain. It can be considered similar to a non-steroidal anti-inflammatory drug, but the mechanism of action is different. Indeed, the non-steroidal anti-inflammatory drugs have as the main target the activity of the cyclooxygenases enzyme. Conversely, CBD cannot interact with cyclooxygenases, but it probably inhibits the reuptake of neurotransmitters like adenosine and endocannabinoids. For example, by improving the concentration of adenosine, adenosine can interact with its receptor, and this led to a series of anti-inflammatory signals. And it is the same mechanism that involves the endocannabinoid that which concentration can be improved, so they can act on CB2 receptor, but also on CB1 receptor, decreasing inflammation and also pain sensation. Moreover, the anti-inflammatory, anti-pain activity of CBD can be due to the interaction with the TRPV1, TRPV2, or TRM8 receptor, which are also involved in pain perception and inflammation. So by influencing the activity of all these receptors with a mechanism that is not very clear, CBD contributes to pain relief and to reduce inflammation. And for this reason, it can be useful in several pain conditions characterized also from by inflammation. For example, it can be useful to treat gastrointestinal problems such as IBD, so Crohn and rectal colitis, IBS, and so on. It can be used to treat inflammation in general, of inflammation in various organs or systems of our body. It can be used against the neuroinflammation, which is characteristic of some neurological pathologies such as encephalomyelitis, multiple sclerosis, and Alzheimer's disease. And it can be used also to treat skin problems such as psoriasis, acne, and so on. Probably one of the most interesting properties of CBD is its anticonvulsivant property, making it a potential treatment for epilepsy. Indeed, researchers have shown that CBD can reduce the frequency and the severity of seizures in people with epilepsy, including those with treatment-resistant epilepsy, especially children. It has been found that CBD can also improve cognitive function and the quality of life in people with epilepsy. And the exact mechanism of how CBD works in epilepsy is not fully understood, but it's true that CBD can interact with the endocannabinoid system, which we know that regulates various physiological processes, including seizure and the control of movements. In this section, CBD is believed to work by reducing inflammation in the brain, reducing also the hyperexcitability of neurons and enhancing the function of the GABA receptor, which are responsible for regulating the activity of neurons in the brain. Moreover, as we have seen before, CBD is a partial agonist of the serotonin 5-HT1A receptor. So, and this interaction can have a neuroprotective effect, and among others, and also CBD can activate TRPV1 receptor, leading to pain relief and anti-inflammatory effects that have been seen to be useful also in epilepsy. Another condition where CBD has shown promising result is autism. We must say that currently there is a limited research on the use of CBD for autism, but a lot of clinical study, like the one that I propose here, suggests that it may have potential as a treatment option for certain symptoms. It has been found that CBD reduces problematic behavior, anxiety, and so on. We can say that considering the data from literature, the best characterized improvement following CBD treatment in autism result in decreased aggression. And this is probably one of the most prominent results. Indeed, in our book, we interviewed various medical doctors who actively use medical cannabis and CBD to treat various symptoms. And one of these doctors said that CBD, in his experience, is very, very effective in decreasing the aggression of children with autism. CBD can also help to increase the attention, to increase the communication and sociability, and to increase the ability to accomplish the assigned task. So CBD can be used as a treatment for autism, but it's important to approach the use of CBD in autism with caution and always under the guidance of a healthcare professional, especially when considering CBD for children or individuals with developmental disorder. Indeed, factors such as dosage, product quality, individual responses can vary, so personalized treatment plans are crucial, like always when we talk about medical cannabis or derivatives. And CBD, like THC, can also be helpful in oncology. Indeed, CBD has been shown to have several properties that can be beneficial for cancer patients. Other than the anti-inflammatory and analgesic properties, CBD has anti-proliferative effects that have been shown, especially in vitro and on animal study. But this effect may help to slow the growth and spread of cancer cell. Furthermore, some studies have suggested that CBD might have potential in managing the symptoms associated with cancer and cancer treatment, so useful in palliative care, and because it can help to relieve pain, nausea, and vomiting. And we know that CBD has fewer side effects than the traditional pain medication, and so it's making it an option for patients who want to avoid the negative side effects of painkillers like opioids and other. Like I showed in this picture, I proposed this study because one of the most characterized anti-cancer effects of CBD has been studied in patients with glioblastoma. Glioblastoma is an highly aggressive and malignant form of brain cancer. It is the most common and deadliest kind of primary brain tumor in adults. And here in this study, published in Molecular Cancer Therapy, it has been seen that CBD can increase the anti-cancer activity of THC toward glioblastoma. And it is for this reason that FDA approved CBD as an orphan drug for some kind of cancer. Maybe you know that an orphan drug is a pharmaceutical agent developed to treat a rare medical condition or disease, often referred as an orphan disease. These diseases are considered orphan because they affect a relatively small number of people, making it financially unattractive for pharmaceutical companies to invest in research and development for treatment for this condition. So orphan drugs are intended to address the unmet medical needs of individuals with rare disease. So it's very important that CBD is considered an orphan drug. And as we can see, it is considered an orphan drug for glioma, for glioblastoma, both as a single use or together with THC. So this is a very important aspect to consider when talking about CBD. Now that we are almost at the end of this talk, let's have a look to the pharmacokinetic properties of CBD. As you can see, the bioavailability by the oral route of CBD is very low. It's around 6%, in line with the other phytocannabinoids. This is due to the significant first-pass metabolism in the liver. Regarding the distribution, CBD, as all the other phytocannabinoids, is a very lipophilic compound. So it has a high volume of distribution, especially in the brain, adipose tissue, and other organs. CBD is extensively metabolized by the liver, where it is hydrolyzed by the cytochrome P450 enzymes. And regarding the elimination route, it is excreted mainly by feces, as well as sent by urines. The half-life in humans, it is estimated around 18-32 hours. Of course, like every compound that we use, every kind of substance that we introduce in our body, also CBD possess some kind of side effects. But as you can see, these are very limited side effects, and they are very manageable. Indeed, regarding the side effects of CBD, it can induce dry mouth, dizziness, nausea, diarrhea, headache, and fatigue. So just considering these slides, we can see how CBD it's a really safe treatment for the condition we explored before, and for a wider a wider range of conditions that we have not time to discuss here, but you can find here in our handbook of clinical cannabinology. So if you compare the side effect, for example, with the side effect of an analgesic compound, a classic non-steroidal anti-inflammatory drug, or a painkiller, you can see that they are very limited and manageable. So it's worth to try CBD in therapy when it is possible, because at least it does not damage the body or the person who is taking it. So this is my last slide, because I want to remember that thanks to the effect we have seen before, CBD contribute to the effects of medical cannabis, because the effects of medical cannabis are mainly due to the action of THC and or CBD, but together with all the other minor phytocannabinoids, terpenes, flavonoids, it exerts the so-called entourage effect that make medical cannabis useful to treat a wide range of conditions. We can enumerate this. For example, it is useful in anorexia and wasting associated with chronic illness. It can be useful to treat anxiety, but it depends. It can have anxiolytic or anxiogenous effects. So it depends on the person, on the quality and quantity of compounds inside the medical cannabis, and so on. It can be useful to treat cancer pain, chemotherapy-induced nausea and vomiting, to treat chronic infection. Indeed, I have not shown this, but CBD is a very useful agent against pathogens, especially drug-resistant pathogens such as Staphylococcus aureus. It is useful to treat chronic pain, to treat chronic regional pain symptom, to treat depression for its neuroprotective effects. It can treat dystonia, epilepsy, seizure, fibromyalgia, migraines. It is very useful for neuropathic pain, for neuropathies. It can counteract opioid dependence, and this is a very important argument that maybe we can have a live just to discuss the effect of CBD, THC, and medical cannabis in general against opioid dependence and other kind of dependencies. It is useful in palliative care to treat Parkinson's disease, polymyalgia, to treat neuropathies, to treat post-traumatic stress disorders, radiculopathies, polymyalgias, rheumatoid arthritis, spasticity, tremors, and so on. So as you can see, thanks to the action of CBD and to the action of THC that we discussed last week, medical cannabis accepts this range of effect. So this was my last slide. I want to thank you all for the attention. Let's see if there are some comments. Maybe we can see the comment of Alexandra. I wonder, I'm currently taking Lyrica, and that is a drug that is used for epileptics. I wonder if there has been an exodus from our many people who have found alternatives using CBD drugs worse, an alternative drug for a drug now to Lyrica and gabapentin. If I understand well, you want to know if CBD can be an alternative to gabapentin. My answer is yes, it can be an alternative to gabapentin because it has anti-seizure effects that are discussed and proved in a lot of clinical trials, also randomized clinical trials. So it can be done, but gabapentin cannot be interrupted. Can be sorry. Can be interrupted slowly, so you have to decrease the assumption of gabapentin. So in order to switch from gabapentin to CBD, it is mandatory to consult a medical doctor, which can help you in this decision. But it is worth to try, if, especially because gabapentins have a lot of side effects, especially neurological effects. So maybe with CBD, or it is also another thing that can be possible is to add CBD to normal anti-epileptic treatment. In this way, you can decrease the dosage of gabapentin or other anti-epileptic drugs to reduce the side effects. Well, half an hour has passed. We are at the end of this live. I want to thank you all for your attention, and see you next week for another Cannabis Sciences live on LinkedIn. Bye.